to Imeko land, and this is Greater Tomorrow Group Medical Committee. In conjunction with MOA Cancer Foundation, we are here to present to you ways to prevent cancer. And with me, we have seasoned professionals who would dissect the topic for us in the layman's standard so that we understand. And the first speaker will be Nurse Okpeyemi. Please put your hands together for her. Followed by Nurse Oluwatumise and our able counselor here, and Esther. So we'll talk about cancer. What is the meaning of cancer? Why do we have cancer? Please have the floor.
Good day, everyone. We're going to talk about cancer today, and we're going to talk about two major types. One which is common with women, and the other which is common with men. So I'm going to define cancer, and we're going to talk about causes, predisposing factors, signs and symptoms, prevention, and also treatment. I'm sure lots of us, all of us, have heard cancer before, and I'm sure we are familiar with that word. But today we're going to sensitize and health educate ourselves, also create awareness about cancers and major ways we can prevent these cancers. So research has it that cancer is one of the leading causes of death worldwide. So that is the essence of this talk today. So like I said earlier, we're going to talk about a cancer that is common in women, which is known as cervical cancers. I know most of us have heard these too. So cervical cancers are like one of the major and commonest cancers that affects women. So cancers are abnormal growth and multiplication of cells, literally. When cells grow abnormally, like enlargement, proliferation, and multiplication of cells in the body, that is what cancer is known as. So there are a group of characteristics and a group of diseases. So the cervix is a reproductive organ found in women, and the cervix is the lower part of the uterus. The uterus is also known as womb. So the cervix is like the neck of the womb. So when there's abnormal growth, when there's a multiplication of growth of cells of the cervix, this term is referred to as cervical cancers. So we're also going to be talking about causes and predisposing factors. Predisposing factors, I mean by risk factors. What are the things that can make one be at the risk of having cervical cancers? And the primary cause of cervical cancers is HPV. I'm sure most of us have heard this at one point in time. So HPV is known as human papilloma virus. So there are a lot of HPV strains of the virus. There are about 100 of it, and most of HPV viruses actually predisposes one to having cervical cancers. Another cause of cervical cancer is genetic factors. What I mean by genetic factors is family history. I'm sure we've heard things like, oh, this person's grandmother or this person's mother had the same thing. So genetic factors means family factors. If that particular disease runs in the family, it can make one prone to having this virus. Another thing is low immune system. Low immune system means that a person is immunodepressed, meaning that the person's immune system is not strong enough to fight against infections and diseases. Immune systems is made up of body tissues and body structures that helps the body to fight against diseases. So if one has a low immunity, it means that the person's body, the person's system is unable to fight against infections and diseases. Multiple sexual partners is also a major thing that predisposes women to cervical cancers. Women that have like 2, 3, 4, 5 sexual partners, meaning they are sleeping with this person, sleeping with that person, and sleeping with this other person. It can predispose one to having cervical. It can predispose one to having human papilloma virus, which will then lead to cervical cancers. Age is also a factor. Research has it that women between the ages of 35 to 40 years are usually at a higher risk of having cervical cancers. Also, early sexual activity also predisposes one to having HPV, which will then lead to cervical cancers. There's some parts of the world and Nigeria where we see young girls of 12, 13, 14, and 15-year-olds already engaging in sexual activities. So these are like major things that causes HPV, which then leads to cervical cancers. We're also going to be talking about the major signs and symptoms. What I mean by signs and symptoms is the attributes, the characteristics that we see in a person that might give us a hint that this person might be having cervical cancers. I'm not saying when one has these symptoms, that means automatically they have cervical cancer. But these are things that shows concerns to say, okay, the next step should be that the woman should go for a test. And I hope you remember that cervical cancers can only be found in women because men do not have cervix. And I said that the cervix is the lower part of the uterus. Uterus is the same as womb. So the neck of the womb is the cervix. Okay, so abnormal vaginal discharge is a major sign and symptom of cervical cancer. The discharge can be bloody, it can be fluid-like, it can be like yellowish serum of any type, and it's usually accompanied by a foul or a bad smell. Another thing, another major sign and symptom is bleeding, and this bleeding can be before period, it can be between period, it can be after period, and even in some elderly women that are diagnosed with cervical cancers, even in menopause, women can still have bleeding. Um, Painful sexual intercourse can also be a major sign and symptom of cervical cancer, meaning when a woman is having pain during sexual intercourse, sexual activities, it might be an indication or be a hint that she might have cervical cancers. Thank you. So my colleague will continue with the diagnosis, treatment, and prevention. Thank you.
Thank you very much. So I'll be speaking on the diagnostic investigations of cervical cancer. How do I mean? According to, she mentioned the signs and symptoms of cervical cancer, but this is not enough to detect or to confirm that a person has cervical cancer. So one of the diagnostic investigation is the pap smear, which is taking samples from the cervix to check for abnormal cells in the cervix. Another one is the HPV test, which is done to check for strands and traces of this human papilloma virus in the cervix. Another is the colposcopy, which is using a special microscope just to examine the cervix, to check if there is growth, if there is tumor, if there is change in the structure, which can be sign or which can dispose one to cervical cancer. Another is the biopsy, which is taking tissue from the cervix to check for cervical cancer. Moving over to the treatments, one of them is surgery, which is hysterectomy. Hysterectomy is the removal of the uterus, and this is done in severe cases whereby the cervical cancer has spread. There are some cases where they remove parts of the cervix, but in this, there is a total removal of the cervix because the cancer has spread, is now severe. Another is radiation therapy, which is using ultraviolet rays to kill these cancer cells. Another is chemotherapy, which is using series of chemicals. They come in form of infusion drugs to kill these cancer cells. Then, talking about prevention, HPV vaccine is really, really important to prevent cervical cancer. And this is best taken in females between 9 to 14 years. And this age bracket is because we believe that at this age, most of them are not being exposed to sex yet. So it is better when they take this HPV vaccine, it prevents them from cervical cancer. Adults can take it too, but then they take it in higher dose. But it is best at 9 to 14 years. Another prevention is the regular pap smear test. where you do regular screening, regular pap smear to check if there is changes, if there is abnormal cell growth. And this is really, really important because in treating cervical cancer, early detection is really, really key. Then safe sex, using condoms, and then the use of fewer sexual partners is really important. And the last I have here is the healthy lifestyle diet. There are some foods like the unhealthy fats, cholesterol, they can predispose one to cancer. So in place of these unhealthy foods, it's advisable we take fresh vegetables, fruits. They are better than all these processed canned food that we take. Another is exercise, regular exercise. It's advisable to stay away from sedentary lifestyle. Another is quit smoking. Smoking predisposes one to cancer. People that smoke is even in this when you check this their carton, it is written there, smokers are likely to die young, it can lead to cancer, it can lead to series of unhealthy things in the body. Then lastly, cleanliness. Please stay clean, live a healthy lifestyle. Cleanliness is next to godliness. Thank you. So I'm passing.
Good day, everyone. So I'm talking on prostate cancer. As we know, prostate is common with men. It's only men that have prostate gland, and the prostate is a walnut-like structure that is found below the testis. So prostate cancer is that cancer that affects the men, that affects their prostate gland. The prostate secretes semen and make it stay healthy. But when you have prostate cancer, you know what it means. So the sperm that you are going to be producing is not even going to, it might not form a child or anything. And the symptoms of prostate cancer is difficult in urination. Some people will find it difficult to urinate, painful urination. Some people they will the bladder with withhold urine. Sometimes it will release anyhow. They will not have control of their bladder. They will just want to urinate at every given time. Another is painful ejaculation. When they are having sex, when they want to ejaculate, there's going to be serious pain and severe pain. Another is weak urine secretion. You not be able to secrete urine. Every little thing, every second you see them, they are going to urinate. They will not have control of their urine. Sometimes some people used to see blood. They will have bloody urination. When they urinate, it comes out with blood. And most of the treatment for prostate cancer, we have surveillance. As we know, cancer, there are some cancers that in some people it grows fast, while in some people it doesn't grow fast. It takes time, like it takes stages. So when the surveillance, like when you notice these little symptoms and you go to the hospital, they will check you. If it is growing slowly or it's growing fast, that's when the surveillance comes in. There are some people they will have to take quick action, while some they will have to take it a step after the other. Surgery, some people go through surgery to stop their prostate cancer. There is prostatectomy, where they remove the part that is affected in the prostate gland. There is radiation therapies. It is also known as chemotherapy, where they will give you some fluid that you will use to reduce the effect of the tumor that is growing in the prostate gland. And the prevention of prostate is maintain a healthy lifestyle, cleanliness, stop taking alcohol. You know, our men, they want to take alcohol at every given time, and this thing is affecting them seriously. Don't even stop taking alcohol, smoking, eat healthy, and watch your health. Proper checkup, go to the hospital regularly, and make your health something that is keen to you. Take it very seriously. Thank you very much.
Please put your hand together for our facilitators. And as you can see that we have good hands who have dissected the topic for us. I don't know if anybody have any question. And if there are no questions, I think we have come to the end of the program. However, yes, we have one question. Sit.
Sorry, what about ladies having infection? There are some discharge that comes out that are like foul smells. What could you say about that one?
Okay. When I mentioned the signs and symptoms of cervical cancers, I said we cannot depend on those signs and symptoms to know if it's cancer or not, and that's why she talked about the diagnosis. So, for a woman who's experiencing abnormal discharges with foul smell, strange colors, and all of that, it's very important that that woman visits the hospital, goes to see a gynecologist. The person will most likely have to do a high vaginal swab test, MCS, that's microscopic culture and sensitivity, where a sample will be taken from the discharge and taken to the hospital. So that test would help to know what infection it is and the drugs that would treat that particular infection. And also, as women, we need to be very hygienic. Menstrual hygiene, personal hygiene, genital care are things we need to take very seriously. Thank you.
Thank you.
I say here I have under detection tips. There is something called testicular self-check. I just want to know about it.
Okay. You know, as men, you know what your testis is. You can just touch. You know how you just touch it. If there is like an abnormal growth, you know the way the testis is. That's an egg inside the sac. You can just touch and check if you notice any abnormalities in it. Maybe one of the eggs is not there, or maybe it is increasing, like it is getting bigger, or maybe you are just feeling something is wrong with it. You can just go to the that's you are checking it by yourself. Then further procedures can be done in the hospital.
Okay, one more question, I will round up.
So from the detection tips, there is something written here. Know your family history and discuss it with your doctor. Is it possible that cancer can be hereditary?
Thank you for your question. The second cause and this predisposing factor I mentioned was genetics. Genetics, I mean to say family history. That's when I made mention of someone's grandma or someone's mom or dad or great grandpa had certain conditions and the generations after have similar conditions. So it's important that we know our family history. Okay, this person's family is like the grandma had, for example, let's say breast cancer. Oh, it's like the mom also died of breast cancer. Or let me even use another disease condition. Oh, the person's great grandmother is hypertensive. Then the person's mother too is also hypertensive. Naturally, such person is at risk. The person is at total risk, at least about 50% risk in cases of hypertension, for example. So knowing your family history, okay, knowing that, okay, in this family, there's no trait of cancer or there is. So those kind of factors can help one to seek early medical care and can also help with early detection. Thank you.
Thank you. Okay, with this, I think we have come to the end of the program. And if you have any questions, please don't hesitate to see the medical committee. We'll be there for you 247. Thank you and God bless you.
Thank you.